the obvious, it's circulatory. It could be anything else.
Neuro?
Could be neuro. Absolutely. Could it be the temperature of their room? They just didn't realize somebody turned the heat down. You'll never know. Okay. Obviously, so think of the obvious, but then if things don't match up the right way, then you need to start thinking outside the box a little bit. Okay, so that was just an example. Okay, any questions about that? Okay, we'll move into observation. So we're looking for shard. Places where you'll see swelling, redness, discoloration, and all that. Sinus, tarsium, and Achilles. On either side of the Achilles. Okay, we'll take a look at this. We'll assess each other today. Asymmetries in the body region. So for today, we're going to go hip down. ASIS, PSIS, and so on and so forth. You'll focus more on that with Janelle's class. Okay, we'll look grossly at the knee. We're not going to get into specifics with the knee, but we'll look at specifics with the feet and ankles and lower leg. Generally speaking, you're looking for muscle tightness, overactivity, weakness, hypertrophy, atrophy. These types of things, again, just verbalize what you're looking at and what you're looking for. We'll go through some of the things that you might find, and then we'll actually assess each other. So, pes planus, pes cavus, equinus deformity. Equinus deformity is a very high arch. That's more developmental, and that typically requires surgery. Pes planus, there's a way to define pes planus. There's a couple things that we can do from an objective standpoint to say, yes, pes planus, or normal, or pes cavus. Okay, pes cavus obviously is a cave. Plain, that's the way I remember it. So flat feet or high arched feet, I think is the layman's term. Hallux valgus typically in the first MTP joint, so the great toe. It deviates laterally. So it's a valgus, no? Yeah, it's a valgus. Okay, so valgus is away from the midline. Medial deviation of the metatarsal head, lateral deviation of the proximal and distal phalanx. Morton's toe is usually related with hallux valgus in that the second toe is longer. You can have Morton's toe without hallux valgus. That is a possibility. The complication with hallux valgus and with Morton's toe. So hallux valgus is typically related to flat feet. I've got them. Okay, so bunion, I guess, is the layman's term as well. It's the chicken or the egg thing. Typically, it's the flat feet that start first because the force goes through the medial side of your foot. It tends to push the big toe laterally as you weight bear through the medial side. Now, typically, you guys know where the force goes through your foot? So if this was my big toe, and that's the bottom of my foot, pinky toe. Has anybody ever done any biomechanical foot stuff to where the heel strike, force normally goes lateral, and then you pronate, it goes through the metatarsal heads, you push off the big toe. Okay, so when you walk normally, it's and then off your big toe. If you have pes planus, it goes through the medial side. Eventually, the big toe gets pushed medially, and if this gets pushed medially, and the second toe is the longest now, the force typically leaves on toe off through the longest toe. So with hallux valgus with Morton's toe, your pressure when you toe off comes through your second toe. Your second toe is not built for that. You can see the difference in size. Stress fractures, impingement of the interdigital nerve, called the Morton's neuroma. If a callus forms around that, and then you'll have numbing and tingling down into your foot, into your toe. So it goes numb, you get all sorts of complications, potentially. So I don't have Morton's toe. I've got hallux valgus, but there are times when it feels really sore under here. But that's not normal, because you're supposed to have a transverse arch. So if you look at your foot, so if you look at your toes, with your big toe, there's an arch where there should be no pressure here in the middle. It should come off your big toe, because that's the one that makes contact with the ground. Okay? So take home message from this. Hallux valgus develops from putting a lot of weight on your medial arch. The medial arch has fallen for some reason. All the weight goes medially, and that forces your big toe over time into this position, making your second toe longer. And then that affects your toe off. That affects when you push off. You cannot generate as much force pushing off your second toe than you can with your first. Look how big that bad boy is. Woo-wee. Okay. Any questions about how it's valgus mortis toe? We have to check out each other's feet, so we got that. Hammer toes, claw toes, and mallet toes. There are pictures in the books. That's just a table summary. I think the visual is more fantastic. And that's what it is. These are developmental type shoes. Okay, so if the toe box doesn't fit properly, okay, you normally wear a size 9.5, but they keep shoving a 9 in front of you, and eventually your toes go like this. Not really comfortable. Again, claw toe up there, hammer toes down here. Mallet toe, just like mallet finger, is a result of an avulsion fracture from what's called the central tendinous slip of your extensor digitorum. We'll get more into that later on. Okay, but this is not chronic. It's not. These ones are chronic. This one is usually more acute. This happens when you forcefully extend your digits and somebody comes along and knocks one. Usually from a football. And if you have a forceful flexion, while this is trying to contract, you're essentially pulling the bone away from the tendon. And then you rip it. If you rip that tendon, you won't be able to extend this, so it'll just dangle. Which is what happened to this bad boy, so I can't get him up anymore. He just won't go up. Okay, so I've had a mallet finger from a basketball with this guy. So same thing happens here. If the tendon, again, is forcefully extending, so you're actively like stretching out your toes, your fingers, and you kick something to forcefully flex that, this is pulling, something else is pushing that down, something's got to give, it's going to rip. And if that rips, you have nothing to pull this up. What you need, so that's the pictorial. When it comes to written tests, this is what they'll ask. Unless they put a picture there and be like, identify this, they'll ask you what's going on. So mallet toe, the MTP joint, so that's MTP, DIP, DIP. The MTP joint will be normal, so this is my foot, by the way. MTP. The PIP will be an extension. The DIP will be flexed. So that's what this table is trying to depict. Okay? Now you don't have to do this with your toes. Do it with your hands, with the person beside you. Try to make your fingers do this. Because that's what your toe will look like. So read this and interpret this in your brain, and then make your finger assume that position. And that's how you know the difference between the three. Okay, so just for clarification, Schultz has this as flexion extension, but generally it's extension. That's the difference between these two. Okay, so one will be like this, like curled, and then the other one at the end will be just extended at the end instead. Okay. Again, so whatever you made with your fingers, does it look like that?
So, I have a question about go back to the graph, kind of, yeah, right there. So, maybe someone already asked this.
Yeah, it is.
Yeah, what's like?
Yeah, so Schultz has it as both, but generally speaking, it's extension.
Okay.
So just keep that as extension. Okay, so gait. You do not need to know this. What you need to know are the two phases, because in the winter, Khadijah will go through postural assessment and a thorough gait assessment. What you need to know, stance phase and swing phase, 60 and 40%. That's all you need to know. Don't worry about all this other stuff that happens. If you're comfortable with this and you want to move on, you can continue and just read this. But you don't need to know all this stuff for my class. I put it up there for just information only. What you need to know is Heel strike is the beginning of the stance phase. Mid-stance, toe off. Once you toe off, it's the swing phase until heel strike happens again. Okay? When do you think most injuries occur? Or when you're getting someone to walk, when would they complain of pain the most in the lower leg, ankle, and foot? Stance phase or swing phase? Stance phase. Usually when they're weight bearing. Right? Is there a possibility that you'll find issues during the swing phase?
Mm-hmm.
Yes. Drop foot is one. Anterior compartment syndrome puts pressure on the anterior tibial nerve. If that's a problem, you won't be able to dorsiflex, and if you can't dorsiflex, your foot will drag. Because once you toe off, you have to be able to dorsiflex to get your foot off the ground, to clear the ground. When you heel strike, you need eccentric control to let your foot down gently. And if you don't, you'll drag, and your foot will just slap the ground. Okay. 60% stand space, 40% swing space. Most injuries occur in the stand space. Some can occur in the swing. That's all you need to know for this. Okay. Another pictorial. Heel strike, stand, until toe off. And opposite heel strike. So all this is your stance phase. And if you're looking at the same leg, that becomes the swing phase. Okay. What's the difference between walking gait and running gait or jogging gait? When does it become a jog? 2 feet are in the air. If both feet are on the ground, no, if one foot is on the ground at least, it's walking. So that's the difference between speed walking and jogging. Exactly. Which I thought was so funny.
They're so funny.
Yeah.
They're so fast.
So they, they do the.
Just like.
I got no hips. But as soon as they leave the ground, now they're cheating because both feet are off the ground, which is against the rules when it comes to speed walking. Definitions. Okay. Point number 2. Verbalize the phase while watching the right leg. So you and a partner, you guys get to walk. If you go outside, you're going to take 5 minutes. 5 minutes only until the song plays. And what I want you to do is verbalize the phases of the right leg. Once you have that and you're comfortable with heel strike, mid stance, toe off. Heel strike, mid stance, toe off, swing. Heel strike, mid stance, toe off, swing. Now start to look at what the feet actually do. Look at the arches. Listen to the heel strike. Start to pay attention to leg rotation, the front of the tibia. See how it rotates relative to the arches of the feet. Okay? And then just grossly look at the knees and the patella at the same time. So you need shorts. And you also need to be barefoot. Okay, so your first goal, verbalize the stances in the gait. And then pay attention to these 4 things. And then come back. Please.